So for our distinguished KOLs, we're very lucky to have them with us today. I have a lot of questions for you guys about exosomes, so I'm going to ask you to be very brief so we can go through all the questions that I have. Exosomes, as we saw during those 4 presentations, are at the heart of rejuvenation medicine. It started almost 20 years ago when PRP, the first kit, was sold in the US, and as Drew mentioned, was nicknamed by the media the vampire facelift. My first question for you guys is why exosomes have become a significant topic in regenerative aesthetics, how exosomes differ from platelet-rich plasma, and just for fun, how would you nickname this technology? Should we start with you, Henry?
Oh my gosh. Well, the nickname is the hardest one. Am I on? I think so. Yeah. So I think it is exciting technology. I think that it is going to come into plastic surgery quickly. The thing we've got to wait on is this FDA approval, and I think that's going to be the hang-up. Things just move slowly through the FDA, but I'm excited about it. I think we'll probably first use it for hair and skin rejuvenation, and then move through for wound healing. But I think that's the way we're going to lean on it. I don't have a tricky name, though.
Lou?
Yeah, I think the manufacturers will have their names. I think that, you know, I'm not an expert on hair, so I'm not as excited about that. But you know, it's interesting. There's emphasis by the manufacturers on FDA routes, but nobody, as far as I can tell, has FDA approval yet. But they're all going around the right way. As a provider, I don't care, you know, we have the luxury of using things off-label. And so for industry, the FDA approvals so they can make claims and indications are very important to them. But for me as a provider, I want efficacy, I want to make sure my patients are getting cared for, and I want safety. And so the nice part is there's a background that we're all getting used to with PRP, and I think of exosomes as a highly concentrated PRP. And I think that we're already seeing them, you know, especially when you think about platelet-derived. I think that that's a benefit in the sense that they're the first to the wound. Plastic surgery, aesthetic surgery is a lot about wound healing. There's a lot of similarities there, and I think it makes sense. There's a logic to it, and I don't try things that aren't logical. So wound healing scenarios, as we've heard from the presenters, post-procedural treatments, it makes complete sense. It'll take longer time to prove that just putting it on topically in non-injured tissue works well, but I know there's data there as well. So I'm interested in the data, I'm interested in efficacy, and I'm going to leave it to our industry colleagues to get through the appropriate consistency, safety, and FDA regulatory stuff that needs to be done.
Steve?
I think of these like the space shuttle. It's like a shuttle zone, maybe, because you can bring any cargo you want to the cell. And it's really quite fascinating when you think about the breadth of what exosomes can do. And granted, we're excited about it in aesthetics, but I think the reach is really far beyond aesthetics for cardiac injuries, neuro injuries, and how it's being used in other areas for that. And the fact that you can put whatever you want into the exosome and then get it to the cell is really quite fascinating. From treating cancer to treating neurological disorders. So I find exosomes, in fact, probably one of the biggest breakthroughs in aesthetic, or in medicine in general. For aesthetics, I'm excited about it. Of course, we just completed a trial with the Rihanna, as Alyssa mentioned, and we saw significant improvement in less downtime, and patients also, and their patient-reported outcomes, thought that their skin was brighter and they looked more youthful at day 14 and day 30. So I think there's a clear, easy, and fast application for a topical. And that's a nice incremental improvement, but the grand leap is probably really going to happen when we start to be able to inject this. Mm-hmm. And we're all super excited for that. And yeah, I think I agree with Lou, the wound healing is great, but how do we get to the next level? And like Lou, I'm not an expert in hair, maybe a little bit more than you, but yeah, I can't wait to start injecting my scalp. So if I'm here next year and you see I have a full head of hair, you're going to know that it's probably the exosomes I'm trying. But I think that concept is great. I know that in Asia, in Korea, and in Japan, there's already a lot of work being done. There's patent pendings for injecting the exosomes. I get excited when I travel overseas and I see the exosomes being used in many ways off-label, but if you speak to physicians who are using it and they're injecting it, they're really talking about the incredible benefits they're getting from it. So I think it'll be really nice to see it get through the FDA, and then it'll have an influence on us. But I agree with you. I think hair and wound healing will probably start with us.
So Justin, let me ask you different questions now. As I mentioned earlier, in Europe, exosomes are plant extract. In the US, they are human derivatives, sometimes autologous, sometimes not. Some are saying that the best exosomes are from placenta or the chorion in particular. Some others pretend that you cannot use one single line of tissues over and over again. So do we have enough data today to confirm or rebuke these assumptions? And do you prefer the autologous or off-the-shelf product that you can find?
Yeah, that's a really hot question, and patients surprisingly are asking as well. It's really interesting. I had a patient reach out, and part of why all this exosome technology is becoming so popular, it's getting a lot of media attention. I had a patient reach out to me. I have the text on my phone. She asked about a vampire facial, wanted to schedule an appointment. I said, okay, well, that's with PRP. Let's talk about exosomes. Might be a better alternative. And immediately, within less than 30 seconds, her response was, what are they sourced from? And I was stunned because there's no biologic background, just a really savvy patient. And so patients are really catching on to this technology, where it's coming from. Is that actually a better source? I use the Exovex chorion-sourced exosomes. So theoretically, they come from 20-year-old placentas, planned C-sections. Great source of stem cells. The exosomes themselves are well suited for, to induce angiogenesis, which is what the chorion and the chorionic villi are for in the uterus. Now, theoretically, yes, that is a great source. Now, I want to see that tracked out clinically, and much like our other panelists have expressed, I would like to see that put head-to-head and actually see if there's an aesthetic benefit. So sure, there may be a theoretical benefit with it being a great source of stem cells and excellent exosomes, but whether or not that pans out to more luminosity on the skin when it's applied, et cetera, I don't think we have enough data yet to confirm or deny that.
Got it. Steve?
I don't know if it really matters as much as where it's coming from as how it's prepared, because there's multiple different ways of preparing it, and they're very expensive and they're burdensome, and some ways you prepare it, you may destroy the cells. So I think that may be more important, as well as but I will say patients in general, I agree with you that they like it. They may ask where it's sourced. I don't get too many people asking for it, but if there is a preference, it's always autographed more than anything else. But these are non-cellular, and in theory, they don't create an immune response. So I don't know if that really makes a difference. I think there's always an ethical issue and a dilemma when it comes to using something that comes from chorionic or placental. Patients sometimes complain about that or are concerned about that. So, and I don't know of any good studies to show that one source is better than another. And I know there are some out there, but I don't know if I can say that right now.
Yeah, I mean, we're hearing 4 different companies from different sources, right? Blood, fat, platelets, et cetera. I look at this history as very similar to what we were doing with fat 15 years ago. There weren't fillers around. So every day in my office, I would harvest fat. I didn't have Bimini's products, so I did it the old-fashioned way. And I'd inject fat for volume in patients, and it was very well received. But soon as there were reliable, safe fillers, I can't think of the last time I did fat grafting in the office. It's always reserved now for the OR when I'm already there doing a facelift. I think this is the same thing. If I can get an off-the-shelf exosome product that we know works, I'm going to reach for that every time as opposed to processing. And I think that's the most exciting thing about here. We've already seen the example with what we do with fat. And as a surgeon, I can process things in the OR. But if I'm in the office, it's safe and effective, I'm going to reach for something that's already prepared.
Yeah, I agree. It is very tough to understand what's going to be the best thing. We've got 4 companies represented here. There are 46 in the country. There's a lot of people making exosomes, and it's hard to really know who's going to have the best purity and the most potency with these exosomes. But somehow I just have comfort, like with the platelets, just because it's a fresh source, and it's not going to come from an embryo or that kind of thing. I don't know. That's a personal thing, but it is, it comes dried. It's easy to access. You can use it in your clinic. So there's a certain satisfaction with using it just at the moment. So I like that. The other thing that maybe is a consideration is, when you're growing these cells with cell source expansion, are you getting some dilution or some loss of potency with these exosomes? And I don't know if anyone knows that either.
Yeah, there's a lot of work to be done. And our last presentation, Rich mentioned that his product has an INCI name and a PC registration, which is the process you do to be considered as a cosmetic. So a lot of those companies today are promoting their product for cosmetic applications because, of course, they don't have yet FDA approval. That said, a lot of those products are sold in sterile vial, and some physicians are using them in IV or subcutaneous. My questions for you guys is, how do you use exosome in your practice? For what type of indications or applications? What are the benefits you're looking for? And how much do you charge for those? And do you think it's cost effective to the patient?
We actually haven't started yet, but we'll probably begin with the plated source topical, from Rion for post laser patients and that sort of thing. I think we're, beyond that, we're waiting for FDA to give us the green light on utilization. I don't even know the cost of those products because we've just had the company come last week, so I don't know how much they cost actually, but I do know doctors who've used those products who like them a lot, and I think across the board it's going to come into play. It's just pretty early for us.
Lou, you're using them in your practice?
Yes. I've used the Rion Intense and the Moderate. I use the Moderate as a global add-on to my post-facelift patients, but the Intense has been very good as a topical, particularly for like rosacea patients, for color patients. I'm most excited about using their new treatment, the Calm, and we've had universal happiness with post-microneedling and post-laser patients. I don't think with some of the new coring, citrellus, et cetera, because they may be considered open wounds, I don't think we have approval to do that. But as a topical, it's good. And I think the idea what Bimini has with their Dermapose, being able to have my physician extenders harvest fat with this new device that makes it easy, will make that more utility, I guess, or easier to use. So I think there's benefits there. I don't have the experience in the other ones. I think that the idea of exosomes really been introduced with things like PRP has made patient acceptance much greater, and the ease of use is wonderful. So I've been very pleased. I'm sorry, expense? I believe the topical skincare retail is in around $240, and the post-procedural might be about $280, and that's probably about 100% markup. The Rion company will forgive me if I misquoted, but I think I'm close. And usually if I do that with a procedure, there'll be some discount off of that because I want the patient to have a good outcome with their procedure.
Steve?
So we're using Dermapose, and I love that system, and it's changed my practice because we can harvest and treat with the fat without, and it's a closed loop, so it stays sterile, so I can do it in the office. But truthfully, I brought it to the OR now because it's so easy to use. I don't have to keep training staff on how to use it. So I really think the Dermapose system has been super helpful for injecting fat both in the OR and in the office. As far as topical Calm product, we used it in open wounds, and we had great results, and patients loved it. It goes on, it feels cooling right away, so it was immediate effect. So I'm a fan of Calm. We'll continue to use it. And as far as pricing on Calm, 100% since I sold my practice, I don't remember or know the pricing. I don't deal with pricing anymore. I'm just, just a talent. But
I think you're $50 less than me.
But it's probably similar to the price point you're selling, at 100% markup is what we're doing. But it's consistent with the other products we're using.
Justin?
So I have been using the Exovex for a couple months now. Post-procedure, post-ablative, non-ablative microneedling within a couple minutes of forming the channel. So having an assistant there, so one practitioner administering the laser treatment when the channels are open, having it topically applied. The price point varies by concentration, the size of the purchase. And so on the Exovex side, they have 5B up to 100B, 5B being 5 billion per exosome concentration per 5 ml. They come in a 5 ml vial. They're frozen. You thaw them for about 20 minutes. You have to use them within an hour. You can put them back in the fridge. You can keep them for up to 5 or 6 hours. And then the cost per vial for a lower concentration, which serves most post-procedure skin topical procedures, is between 170 and 200 per vial cost to the practice. And so we sell it for a markup of about 500 to 600 post-procedure, which is a reasonable markup. Now our patients are paying, without exosomes, $200 to $300 for post-laser skincare anyway, and so that pricing sits well with them.
And you apply that topically, correct?
Topically in office. So, there are other products that you can send the patient home with. The Exovex chorion-derived exosomes, I apply topically in the office, and it's a one-time post-procedure. Now, I did treat Grant a couple weeks ago. That's why his face is looking smooth as a baby's butt. And so, I said if it can make Grant glow, then it must be working. And so we used the Exovex exosomes at the time of a pretty aggressive halo on him. The downtime on a halo, I'm pretty aggressive with our halo settings, and so those patients can have 7 to 10 up to 14 days of pretty extreme swelling, especially if you're treating deeper for acne scarring. And I would say it probably shaves about 30% off the downtime. Another anecdote I'll share with you, I did a laser on my esthetician, and that after these ablative and non-ablative lasers, especially when you go deep, they have a considerable amount of just discomfort burning before discharge out of the office, and so we have them blow cold air on their faces, and it's like prying it out of their cold hands to get that air blower off. And my esthetician commented that right after the application of the exosomes, and I think Dr. Jin mentioned that. She said it was almost immediate reduction in the burning, which is pretty significant. So, and then circling back around to price point, at the higher concentration, about 100B, the 100 billion per 5 ml, that cost per vial is going to be almost $1,000. And so, whether it's a VIP patient or someone that has, unlimited funds, which most patients don't, and so we tend to stick with the 5B because the price point is more cost effective. I do think the 100B is probably more effective if you're treating with alopecia and probably more consistent with the cost of the procedure. If we're doing PRP and fat grafting to the scalp for hair loss, male pattern baldness, that's going to be $5,000 to $8,000 that the patients are accustomed to paying. So I think you can bundle in that cost a lot more effectively.
So we'll go back to the concentration in a second. Any adverse event or side effects we should be aware of or concerned about?
I want to mention something, Philippe, that you touched on about injecting it. And there are doctors in the U.S. who are injecting it.
Absolutely. In IV.
Yeah, and it's obviously the risk is high, and the FDA has come directly out and warned against doing that. But I know of two good friends that we all kind of know, they're key opinion leaders who are injecting it with tremendous results, at least that's what they're telling us. But I think it's a really risky venture to do it. So.
If you ask our plastic surgery community about exosomes, the one negative you'll hear is that it's like the wild, wild west. People are injecting, doing things on their own they think might work, and they don't really understand the science well enough. So there's a fine line between using, again, logic and safety first, and then, we can be our own worst enemies sometimes as well. And I think that's policing ourselves. I don't think anybody else there's no regulatory commission is going to do anything better than that.
But Lou, you said at the beginning that you're not waiting for FDA approval. You can use the product off-label. So no surprise that physicians now are experiencing different ways of using those products, IV, subcutaneous, or topical, and for different indications or applications.
Yeah, I mean, it's an interesting world we live in. There's we talk about breast reconstruction and ADMs, and you can't get an indication despite the fact that these are breast cancer patients who need help, et cetera. So you can't say that you're using it in the breast, right? But we all know that it works real well, and it's so peculiar. Then we take something else, we inject it in places we've never seen, or put it IV, and we don't even know what it does. And so there's again, that's the fine line we all walk. Do no harm first as a physician, but we all don't follow that, and then industry has their arms behind their back, not be able to make indications for good use for things that are really helpful. It's problematic, but there's no simple answer to it.
So Justin, let me go back to you. We were talking about concentration. we know that those exosomes can come in 1 billion to almost 450 billions. How do you select the right concentration, and how do you know? There's no clinical data or studies that have compared the different concentrations. So it's, how do you select the right vial for your patient?
Yeah, I mean, I think we're still learning about this. I'm very transparent with patients. You know, I think you get into trouble when you overpromise and claim that you know everything about how this product works or what the right concentration is. I select it based on safety and price point. And so, you know, in the patients that we've treated, the $5 billion for topical post-procedure works well. The price point fits with what the patients are expecting to pay. Until I see a study that shows that 12 billion versus 25 billion versus 5 billion is you know, there's a clinical aesthetic difference, you know, to have the patient pay more for something that we're not sure is actually making an aesthetic difference for them, you know, I just don't think that's appropriate at this point. And so 5B at this point is what I use for topical post-procedure. And then I think if you're going for a more, you know, like an alopecia type treatment, I think a higher concentration would be appropriate and justified, certainly from a cost perspective as well. But again, there's no data. You know, we don't have that study showing that 5 versus 12 versus 25B gives you brighter looking skin or reduces your redness more or decreases the pain. When I see that study, then certainly we can pivot.
Great. Henry, I want to go back to you. How is regenerative medicine going to impact your practice? Now we're talking about prevention rather than repair.
I think it's all coming. I mean, plastic surgeons are adjusting right now to that. I mean, pretty much we grew up with reconstructive attitudes, and we've all kind of bridged over on the aesthetic side. And what's happening now is really broadened substantially. With Ozempic, you know, it's bringing a lot of different patients into our practice. I think with Exosomes, it's going to bring a lot of different patients into our practice that are just interested in longevity and lifestyle, you know, in general. And so I think we have to embrace that. I think that's a part of how we're going to grow, and it's a very important part of the vitality in plastic surgery practices.
Lou?
I think, again, if you think about the fastest growing market, it's young people too. So, and who's going to work, this is going to work the best on? Young people. Their tissues are more receptive, they're more regenerative. We heard already that young tissues as a source works better than older tissues. So the concept of prejuvenation with something that does not cause inflammatory problems. I mean, again, we're just hearing whispers occasionally of long-term multiple filler treatments, whether it's the ester or something else, having some lymphatic obstruction or other negatives. If you can start using something that's regenerative early on to allow you to look good and heal, I think there'd be less hesitancy to do that for a lifelong use. So that's a great group. They may be the group that needs it the least, but they're also the group that's most excited. And then if we can make it affordable for them, that's one, and painless, you have a winning formula.
Steve?
I think regenerative is exciting and it's sexy and it's hot, but we don't really have much in that category right now. We're using some fillers and we're trying to get regenerative properties and patients like it. But if we're really going to go after regenerative and we're going to say this is the future of aesthetics, then I think you really have to start to consider what is regenerative medicine, and that includes hormonal, that may include bone induction.
Mm-hmm.
There's so many other areas to really, nutraceuticals, that really make regenerative medicine the future of aesthetics, and we're not even close to putting this together as a whole field, but I think we all see it.
Interesting.
Yeah, I would agree. I think we're just starting to scratch the surface. I would agree that, you know, I look at it as a bigger umbrella of regenerative medicine, and then regenerative aesthetics is a subsection of that. And so I think we're just starting to scratch the surface of regenerative aesthetics and some of the presentations earlier really nicely laid out where this can pan out. You know, I'm a surgeon, and so my mind goes to nerve regeneration, allografts, augmenting, you know, some of these other implantable devices that we use to try to encourage tissue regeneration, tissue ischemia, right? Like there's so much potential beyond just making the skin look brighter and have less red pigment. And so it's a really hot topic. And honestly, the more I think about it, my head spins in a good way. And so I think that means that we're starting to understand something really exciting.
So it's a great segue to my next question, since it's going to be the last questions of the session this morning. Every year I ask my panelists to take out their crystal ball and tell me, okay, we're 5 years out. Tell me, predict the future and how you see regenerative medicine and the impact it's going to have on your practice. I asked that question to ChatGPT. I don't know if you know the new AI system developed by Sam Altman, but I asked the questions, what's the future of exosome and regenerative medicine? And the answer that I got, and I'm going to read a few lines, it predicts that skin regeneration and rejuvenation will be the #1 element, and exosome derived from stem cells or fibroblasts can promote the growth and proliferation. Then talks about wound healing and how exosome can be used for wound healing, and then drug delivery. What would you say, what's your crystal ball says 5 years down the road, exosome, regenerative medicine?
I think it's going to be incorporated specifically in plastic surgery, into our practices with this functional medicine component kind of moving in. More and more patients, it seems like half the patients I see now are on a functional medicine plan, with hormones and nutritional support, et cetera, and they're looking really for the surgical part. But we're beginning to embrace that, because I think it's an important part of keeping our patients in the deck, and just like with Botox, if that's been a really important part in patients' return to our office. Before they come in for surgery every 10 years, I can't remember who the guy was 10 years ago, but with Botox, at least they're coming in. And I think with exosomes, it's another part of that puzzle, and it's going to make our practices continue to grow faster. I think it's a great thing.
I would agree. Look at orthopedics. Orthopedics, you've been listening now about, regenerative medicine. Don't have your knees replaced. Let's inject your knees. Let's do all that, right? Well, they're those same patients who are athletic and fit want to look better, and it's the same thing for us. I think regenerative medicine in 5 years will be part of the mainstream of our practices. If you have a practice that embraces non-surgical stuff. If you're simply a surgeon, then you might use it as an ancillary project to your surgery. But I think in my practice, our practice, it'll be mainstream.
I think that in two generations, I think within 2 generations, the medical students are going to look at us and they're going to say, "You used to cut people? That's so barbaric. I mean, you used to knife and cut people open. How could you do that?" So I think we're heading there faster than we realize as technology continues to rapidly progress. But in the short term, I think as you see consolidation in medicine, it's not just plastic surgeons coming together or aesthetic practices coming together. I think consolidation is going to be much more than that. I think you're going to see dentistry come together with functional medicine and aesthetics. And it's very easy when we're consolidated to have these groups come together. And I think it's also we're going to consolidate with industry. So I wouldn't be surprised if some of our industries start to have clinics in the future getting around the regulatory issues. But I think I see consolidation really changing a lot in the next 5 to 10 years.
Justin?
Yeah, I echo what a lot of the panelists had mentioned. I visualize it as kind of tailored, individualized wellness, right? And so, before we just thought about surgery and then have expanded to non-surgical and maintenance and prevention. And I think that's going to expand even further into wellness. And certainly in Southern California, that's what people value. Yes, it's looking better, maintaining their non-surgicals, but providing them a way to be well and healthy. I think this opens up a whole other section of how we can holistically take care of our patients. And patients want it. They want an option for wellness, and if they don't get it in our office, they're going to go somewhere else for it.
So my last question is for Steve, and it's a personal question. Steve, you're going to be a dad pretty soon.
What's that?
You're going to be a dad pretty soon.
For the 4th time, yes.
Are you going to extract the stem cell from the placenta and freeze it and keep it just in case?
Well, for a couple of thoughts, and it's interesting, he says, I had a daughter who was sick many years ago, 10 years ago, or no, 20 years ago she was born, and they just started freezing stem cells at that time from the placenta. And then we did it for my third daughter because we wanted to, in case our second daughter needed those stem cell transplants in the future. So yes, I'm a believer in that. But more importantly, I will tell you that since Sabrina and I are having a baby, we are now taking contracts for exclusive speaking for the baby, for the future, and consulting. If you sign up now, I'll give you a deal. You get the baby for the next 20 years.
Thank you to the panel, and have a great lunch. Thank you.
Thank you.